In the quiet corners of our world, life unfolds in countless forms, often unseen. But sometimes, the delicate balance of nature is disrupted, leaving the most vulnerable exposed. A tiny turtle hatchling, disoriented and alone, discovered far from its nesting site. Or a gecko, injured by a domestic animal, its future uncertain. These moments mark the beginning of a crucial journey, one that demands specialized knowledge and unwavering dedication, the rescue and rehabilitation of orphaned and injured reptiles. Their survival hinges on human intervention, a lifeline extended by those committed to preserving wildlife. Wildlife rehabilitators often operate on the front lines, responding to calls about displaced, injured, or orphaned reptiles. These creatures, from tiny hatchlings to mature adults, face myriad threats: habitat loss, vehicle collisions, attacks from predators, and even human cruelty. Without a dedicated sanctuary, many would not survive. The mission is clear: provide immediate care, restore health, and ultimately, prepare them for a return to their natural habitat. It's a complex task, requiring expertise not just in veterinary science, but in the intricate behaviors and ecological needs of each unique species. The journey for a rescued reptile begins with intake and a thorough assessment. Upon arrival at a rehabilitation center, each animal undergoes a meticulous examination. Rehabilitators document every detail: species, estimated age, weight, and any visible injuries or abnormalities. This initial triage is critical, as it dictates the immediate course of action. Dehydration is common, requiring fluid therapy, while wounds are cleaned and treated. A proper assessment ensures that the unique needs of each individual are identified, setting the foundation for effective, species-specific care and increasing their chances of recovery. For many rescued reptiles, especially those found as eggs, the rehabilitation process starts with a delicate phase: incubation. This is particularly crucial for orphaned clutches or eggs found in compromised nests. The success of hatching hinges on replicating the precise environmental conditions of their natural habitat. Temperature and humidity are paramount, as even slight deviations can be fatal or lead to developmental abnormalities. Rehabilitators utilize specialized incubators to provide a stable, controlled environment, nurturing life from its earliest, most vulnerable stage, giving these embryos their first chance at survival. Temperature is perhaps the single most critical factor in reptile development and health. For eggs, it can even determine sex in species like turtles and alligators. For hatchlings and juveniles, precise thermal gradients are essential for metabolism, digestion, and immune function. Rehabilitators must maintain specific ambient temperatures, basking spots, and cool zones within enclosures. This often means using heat lamps, ceramic emitters, and heating mats, all carefully regulated by thermostats to mimic natural conditions. Understanding and controlling these thermal requirements is a constant challenge, vital for the reptile's survival and growth. The optimal incubation parameters vary significantly across reptile species. For example, snapping turtle eggs thrive at temperatures around 25 to 29 degrees Celsius, 77 to 84 degrees Fahrenheit, with high humidity, while many gecko species require slightly different ranges, often preferring temperatures around 26 to 31 degrees Celsius, 79 to 88 degrees Fahrenheit. Snake eggs also have specific needs, usually around 28 to 31 degrees Celsius, 82 to 88 degrees Fahrenheit, and moderate humidity to prevent desiccation. These precise conditions are monitored daily, sometimes hourly, by rehabilitators. Specialized substrates, like vermiculite or perlite, are often used to maintain consistent moisture levels, creating the perfect microclimate for each developing embryo. When a reptile egg finally hatches, it's a moment of triumph. But the work doesn't stop there. Hatchlings are incredibly vulnerable and require immediate, specialized attention. Many species emerge with a yolk sac still attached, providing essential nutrients for the first few days. It's crucial not to separate them until the yolk is fully absorbed. Providing a secure, appropriately sized enclosure with optimal temperature and humidity is paramount. Rehabilitators carefully observe their activity, ensuring they are strong, alert, and ready to begin their journey towards independent feeding, a critical milestone for their survival. Beyond incubation, maintaining precise temperature and environmental control remains critical for growing reptiles. Different species have vastly different needs. Diurnal lizards, like many skinks, require strong UVB lighting for vitamin D3 synthesis and a warm basking spot often reaching 32 to 38 degrees Celsius, 90 to 100 degrees Fahrenheit. Nocturnal geckos, conversely, need consistent ambient temperatures around 24 to 28 degrees Celsius, 75 to 82 degrees Fahrenheit, with no direct basking. Aquatic turtles necessitate heated water, often around 24 to 27 degrees Celsius, 75 to 80 degrees Fahrenheit, in addition to a dry basking area. These carefully constructed environments mimic their natural niches, promoting healthy development and strengthening them for eventual release. One of the most challenging aspects of rehabilitation is specialized feeding. Reptiles exhibit a wide array of dietary preferences, and accurately replicating these in captivity is essential. For herbivorous species like tortoises or iguanas, a varied diet of fresh, leafy greens such as dandelion, kale, and collard greens is crucial. They also benefit from certain fruits in moderation. Calcium and vitamin supplements are often dusted onto their food to prevent metabolic bone disease, a common ailment in captive reptiles. Rehabilitators carefully monitor intake, ensuring these gentle giants receive all necessary nutrients for robust health. Carnivorous and insectivorous reptiles present a different set of feeding challenges. Snakes, depending on their species and size, may require anything from pinky mice to small rats, often offered thaw to avoid injury. Insectivores like many lizards and frogs thrive on a diet of crickets, mealworms, and dubia roaches, often gut-loaded with nutrients before feeding. The timing and frequency of meals are also critical. Hatchling snakes might be fed every 5 to 7 days, while adult lizards may eat daily. Rehabilitators must also stimulate natural hunting instincts, encouraging active foraging to prepare them for life in the wild. Some reptiles, particularly those stressed or injured, may refuse to eat, posing a significant challenge. Rehabilitators employ various techniques to encourage feeding, from offering a wider variety of prey items to creating a more secluded feeding environment. If all else fails, careful force feeding may be necessary to prevent starvation and ensure the animal receives vital nutrients for recovery. This delicate procedure requires immense skill and patience to avoid causing further stress or injury. It's a testament to the rehabilitators' dedication, pushing through difficult moments to sustain the life of their charges. Beyond feeding and environmental control, many rescued reptiles arrive with significant injuries or illnesses that require direct medical intervention. This can range from treating severe wounds caused by animal attacks or vehicle collisions to administering medication for internal parasites or infections. Fractures may need stabilization, and abscesses require draining. Collaborating with veterinarians, rehabilitators provide specialized care, often involving careful monitoring of medication dosages and response. Each successful treatment brings the reptile one step closer to regaining full health and the strength needed to navigate the challenges of the wild. Throughout their rehabilitation, each reptile's progress is meticulously tracked. Regular weigh-ins are essential to monitor growth and ensure proper nutrition. Measurements of length or shell size provide further data points. Any changes in behavior, appetite, or physical condition are recorded. This continuous monitoring allows rehabilitators to adjust care plans, fine-tune diets, and identify potential issues before they become critical. It's a quantitative approach to qualitative care, ensuring that every individual is on the right trajectory for recovery, building strength and resilience for their eventual return to the wild. Preparing a reptile for release means more than just physical healing, it involves reawakening and sharpening their natural instincts. This is achieved through environmental enrichment and behavioral conditioning. Larger enclosures simulate natural habitats, providing opportunities for climbing, burrowing, and hiding. Live prey is sometimes introduced to encourage hunting behaviors in carnivorous species. This period of conditioning minimizes human interaction, fostering independence and wariness, crucial for survival in the wild. The goal is to ensure the reptile is not just healthy, but fully equipped with the skills and instincts needed to thrive on its own. Before any reptile is released, it undergoes a rigorous pre-release assessment. This final evaluation ensures the animal is physically fit, behaviorally sound, and capable of surviving independently. Health checks include blood work, parasite screenings, and a thorough physical examination. Rehabilitators also observe natural behaviors. Does the snake hunt effectively? Does the turtle avoid humans? Is the lizard exhibiting appropriate social cues? Only when all criteria are met, and the reptile demonstrates full readiness, is the complex process of selecting an appropriate release site initiated. This ensures the best chance of long-term survival in its natural environment. The release is the culmination of months, sometimes years, of dedicated care. The chosen site is carefully selected based on the species-specific habitat requirements, proximity to the rescue location, and absence of significant threats. For aquatic species like turtles, a healthy pond or wetland with ample food and cover is chosen. Terrestrial snakes and lizards are released in areas with appropriate vegetation, shelter, and prey. The release itself is often a quiet, respectful moment, allowing the reptile to emerge at its own pace, a silent promise of freedom fulfilled, a second chance granted by human compassion. The work of wildlife rehabilitators is a quiet but profound act of conservation. Each successful release is a victory, not just for the individual animal, but for biodiversity. By saving orphaned and injured reptiles, they help maintain ecological balance, genetic diversity, and educate the public on the importance of these often misunderstood creatures. Yet, the challenges continue to grow, as habitat destruction and human encroachment push more species to the brink. Their tireless efforts remind us that every life holds value, and with dedication, even the most fragile can be given a chance to thrive. The commitment of wildlife rehabilitators is unwavering, but their resources are often stretched thin. You can play a vital role in supporting these critical efforts. Consider donating to local wildlife rehabilitation centers, volunteering your time, or simply being more aware of your surroundings to prevent harm to wildlife. If you encounter an injured or orphaned reptile, always contact a trained professional rather than attempting to intervene yourself. Every action, no matter how small, contributes to the survival of these remarkable creatures and the health of our planet's diverse ecosystems. Together, we can ensure a future for scaled survivors.